When you hear she buzzing, big problems coming, big problems coming, big problems coming. Look this little mosquito, big problems.
Through the Lil Mosquito Big Problem campaign, Breakthrough Action is reaching the people most affected, minors, using language and strategies that motivate them to take action against malaria. As the project draws to a close, the impact of social and behavioral change is clear, both in the voices of the minors and in the changing statistics.
The campaign uses a human-centered design approach, the HCD approach, and therefore one of the things about that approach is that you try to see the solutions to problems through the eyes of the beneficiaries and not, as an implementer through my eyes. And because of that, when we went out, for example, into the regions to test some of the prototypes we developed, let's say, for example, a poster, and we may have it created in a particular way, but after it went through that pre-testing process, and the miners were able to provide their feedback, or the regional VCS or staff, or even the staff in Georgetown from the National Malaria Program or the Public Relations Health Promotions Unit, once they provided feedback, then it was amazing to see how the material, evolved to really reflect the desires of the beneficiaries.
Attention Region 8, it's time to get your treated nets. The Ministry of Health is giving away free insecticide-treated nets for beds and hammocks to residents of Region 8.
Through the messages delivered in common Guyanese parlance and at broadcast times minors could engage with, the LMBP campaign made sure malaria prevention, testing and treatment were accessible and understood by minors far away from reliable signal and their families.
So because we have to recognize that we have malaria endemic hinterland regions and a lot of far-flung areas, once they're able to recognize these brightly colored vinyl posters at those testing sites, right away it would prompt them to to seek care, because in recognizing that all the materials that they were given, if they recognize that they have fever, muscle aches and pains, headaches within 24 hours, that information, they can approach those sites right away and be tested.
So our campaign materials were developed taking into consideration the miners, their lifestyle, and how they live and so on. So implementing our activities, then going back, for example, with sleeping under the nets, we encourage miners to sleep under the nets, get tested early, complete their malaria treatment. So going back into the fields and, listening to the miners talk, and they relay these messages to you, I've been sleeping under my net, I go and get tests early, I take the ministry's treatment, I saw this poster that you guys put up, I know where to get tested. So
the LMBP campaign's true success lies in its ability to integrate malaria prevention, testing, and treatment into everyday life, making these practices a part of the miners' routines and conversations.
I think that Breakthrough Action started this whole concept to use social behavioral change strategies. I think when they started, miners had a lot of misbeliefs and misconceptions about malaria care, malaria prevention, not using bed nets, not getting diagnosed or treated. And now that has changed. And I think it's because of the work that Breakthrough Action has done in collaboration with the Ministry of Health. The methodology they use, as I said, that is patient-centered, earn the trust of the clients, but also the trust of the community members.
Breakthrough Action, in partnership with the Ministry of Health and organizations across Guyana, has shown that even the smallest changes in behavior can lead to the biggest victories.
So across the years, we've had various tools that was developed, but there is one in particular that really made an impact for me, and that is the treatment envelope. Because I could remember back in 2018, it just started, with a simple pill case, and it developed into this extraordinary treatment envelope that the miners would use to understand how to use their treatment, right? And one of the ministry's policy is to have persons complete their malaria treatment. So having this simplified package that persons could see and understand what they need to do to complete their treatment was a really great impact for me, and one of my very favorite interventions.
Big problems coming. I said this.
Every day in camp and we listen the same thing. The advertisement that has been on the radio. Say, little mosquito, big problem. You got radio right now in camp. As watch this radio, and that's the last thing I hear from this radio. That's the last thing I hear from this radio. Little mosquito, big problem. This radio cut off, and we never get back this radio for more. So I say mosquito is real problem for two, I tell anybody. Little mosquito is real problem for two. Because if I carry camp now and show this radio playing nice, I like this radio, but that's the last thing we hear from this radio. Little mosquito is big problem.
Problems coming. I said this little mosquito.